As soon as alcohol enters the body, whether it's a low-alcohol drink, a fermentation product, an energy drink, kumis, ayran, it doesn't matter, even non-alcoholic beer, a reaction begins. What kind? A reaction of the cardiovascular and respiratory systems. The cardiovascular reactions include increased heart rate or decreased heart rate, increased or decreased blood pressure. There may be fluctuations in blood pressure, jumping up to 220, then down to 90 or 100. Increased pulse, a feeling of anxiety, restlessness, internal trembling, also colloquially referred to as jelly. Something is wrong, something is off. A feeling of instability and unpredictability, that something bad is going to happen. In the respiratory system, there is a sensation of air shortage, difficulty breathing. The person starts to feel. Manifestations vary in nature, either skin redness or, on the contrary, paleness, cyanosis, acrocyanosis. That is, it turns black, starts trembling, tremor may appear. Certainly, neurological symptoms appear. Nausea or vomiting, which does not bring relief but rather worsens the condition. I usually tell patients when we perform a prohibitive procedure, I say, guys, you have 40 minutes before opening a bottle of vodka. Shout, help. Run to the emergency department where they can revive you, where they can provide you with corrective assistance, removing intoxication. At that moment, if you manage to say that you have undergone a prohibitive procedure and you have a drug that is incompatible with alcohol, that's great. If not, it will work as an unknown toxic substance. This can be saved. You always have half an hour to 40 minutes before the maximum reaction occurs, before the kidneys, liver fail, before it fails. The brain, from what is happening. And as for this state, a panic state occurs, like anxiety, fear, it appears it will pass. But intoxication, the blow to the liver, is inevitable. And those actions, like those of a drowning person, can be thoughtless. You might harm yourself. Therefore, it is suggested, always after the prohibitive procedure, take a bottle of water with you, which you bought yourself, at the table, because our people, well, it's a sacred thing. How not to check? He sits, doesn't drink, and suddenly the doctor somehow did something wrong and didn't do it. Let's pour some into his compote and see what happens. You have half an hour until the maximum effect of the drug, prohibitive, incompatible with alcohol.